This is our second quarter TAC Health Huddle webinar. And with me, I guess I should introduce myself first. I know a lot of y'all, but my name is Carrie Chin. I'm the Wellness Program Administrator for the Healthy County Program. And we also have Sharif Muhammad. He is the Wellness Consultant for the Northwest region, and Tasha Brent, who is the Wellness Consultant for the East. The topic we're going to talk about today is prevention. The power of prevention and looking at the different ways that we can help prevent disease, so prevent chronic disease. And these are some of the things we're going to touch on. So we're going to talk about nutrition, exercise, lifestyle factors, including things like sleep and stress management and how those are so important when it comes to preventing illness. And then we're also going to talk about preventive screenings. All right. So we're going to go ahead and jump into our first poll.
If 650 commercial airplanes, each carrying 180 passengers, totaling 117,000 people crash every day, would you fly? Yes or no?
I don't know. What do y'all think? Would you fly?
I don't know.
Yes.
Okay, well,
We got some daredevils in the chat.
Yeah.
117,000 people crashed every single day.
I don't know if I would.
I don't know if I would either.
I don't know. I've got family out of state, so I think I might still fly.
But this is important because this is equivalent to the amount of people that died from chronic diseases. In 2021, it was shown that 43 million people worldwide died from chronic diseases. So that totaled 75% of all deaths coming from chronic diseases. And that's important because these diseases come from our lifestyle behaviors. So according to some studies, what percentage of premature deaths is attributed to our individual behavior, those lifestyle behaviors I was talking about? Is it 30%, 40%, 60, 70?
All right.
You got it right?
Yeah,
40%.
half.
All right.
All right,
Nessa's on the
Love
leaderboard.
it.
Nessa's in the lead. So speaking about these individual behaviors, most people like to bring up genetics, which also play a part. Where we live in the world, so our environment plays a part. But the biggest impact that we have is with these individual behaviors, because lifestyle behaviors strongly influence whether these risks are reduced or amplified. And a few that we have here are healthy eating, stress, sleep, tobacco use, alcohol consumption, excess body weight, and physical activity. All of these play a part in reducing chronic conditions and being able to stop these things prior to becoming catastrophic consequences. So these conditions, they develop through years of small habits and exposures that gradually affect the body. The positive side is that small healthy behaviors can also build over time. So we see this snowball effect that can cause catastrophic events if we don't prevent the chronic conditions earlier. But the bright side to that is we can also prevent these things from happening and even reverse some of these chronic conditions as well. So prevention. So we want to be proactive rather than reactive with our healthcare. We want to reduce risk before disease develops. And an important thing, these healthy behaviors can also help to reverse all chronic conditions as well. We've heard stories in counties of individuals changing their lifestyle behaviors and getting off of type 2 diabetes medications, improving their blood pressure. But all of these things can be attributed to our lifestyle behaviors. And one of the main lifestyle behaviors that plays a part is our nutritional habits. So according to dietary guidelines for Americans, how many servings of fruits and vegetables should adults consume daily?
All right. Is it 1 fruit and 1 vegetable? 4 fruits, 4 vegetables? What are we thinking? It is 2 fruits, 3 vegetables. Good job. Let's see that leaderboard. Uh-oh, Nessa. LS is coming for you. We'll have to look and see who LS is. But it is 2 fruits, 3 vegetables. And so we're going to just talk about some nutrition and how it can impact your health. We think about this all of the time when we think about our day-to-day life, how we're feeling. And oftentimes when we're thinking about our health, our diet is the first thing that comes to mind of what is a behavior that I can change. So just a reminder that food is more than fuel. So not only is it obviously the calories that you need for energy to just kind of get through your everyday, but it really regulates your mood. It impacts your brain function. It can also impact inflammation within your body. Depending on what you're eating, can really influence that chronic inflammation. And when you have inflammation, it can build up and make you at a higher risk for having high blood pressure, high cholesterol. It's going to influence your blood sugar and your body's ability to process that. You're making you more high risk for type 2 diabetes. And this is all going to attribute to advanced risks for some of those long-term diseases that Sharif mentioned previously that are manageable or could be preventable based on some behavior. So nutrition really is important, not just for our overall, the way that we feel on a day-to-day basis, but the long-term effects that it can have on our body. We think about this as if y'all were joined the last health huddle in Q4 that the wellness consultants did, Michelle and I talked about the nutrition gaps becoming health gaps. And it really is true that whenever you are lacking certain things within your body, you have a deficiency and it ultimately can lead to higher risks. So when you are not consuming enough protein, this is going to impact your body's ability to build muscle. It's going to impact your bone density and again, have an impact on you as you age and increase your risk for certain types of diseases as well as, chronic problems with like injuries when you fall or recovering and things like that, which once again, if you are down on your, a bad back or, a broken hip, that's going to make you more physically inactive, which is in turn going to increase risk. So it really is important to make sure that you are getting enough protein in your diet to make sure that you are maintaining some good muscle density and also fiber. This really impacts gut health. Again, that glucose regulation to maintain your risks for type 2 diabetes and cardiovascular disease. So we want to make sure that we are consuming foods that are high in fiber and knowing how to get those whole grain foods. If you are familiar with the USDA guidelines on a balanced diet, they say to make sure that 50% of your foods are whole grain to make sure that you're getting, consistent fiber. You can get fiber in some vegetables as well. So just making sure that you're paying attention to that. Also making sure that you're getting all of the vitamins that you need. And this is why fruits and vegetables is so important because there's so many vitamins that you get from eating fruits and vegetables. And about 1 in 10 adult Americans do not get enough fruits and vegetables in their diet. And so when you think about that, 10% of people not getting enough fruits and vegetables, that's a lot of nutrients and nutrition that we're lacking on a day-to-day basis. So that's a really, really easy way that we can make a small change to get a lot of the nutrients that our body needs in order to process everything to maintain a healthy system. I like to think of my body as a machine, and you're not going to put diesel in a gas engine. So why are we going to put highly processed foods into our system, knowing that our body doesn't function appropriately on those things? All it's going to do is cause disruption, dysregulation, and overall, and over time, it's going to just wear us down and break us. So it really is important to make sure that you are getting the proper nutrition before it becomes a bigger health consequence. So I've got 6 tips for nutrition, because like I mentioned, it really is hard to look at our behaviors and make a lot of big changes at one time. So there are some small things that we can do for some nutrition tips to make sure that we are getting, at least a good start on some changes that we can make if there are some behaviors that we notice within ourselves that we can change. One of those is, like I mentioned, eating more plants, eating more fruits and vegetables. Um, I I did mention that 10% of adult Americans are not getting enough fruits and vegetables. And that is a huge statistic when you think about it. And this is one of the simplest things that we can do. If I don't know if any of you have ever had a smoothie demo at your county, but Mark Zolich, one of our other wellness consultants for the West Territory, a few years ago came up with a smoothie demo presentation, and we take that out to the counties because it is a really great way to show people how you can get fruits and vegetables in your diet, especially if you don't like them. They're hard to eat. A lot of times people think that they don't know how to cook them. They don't know what to do with them. They don't enjoy eating them because they don't like the flavor. But there are ways that you can come up with to get more fruits and vegetables in your diet. And that's going to make a very big difference for that fiber and vitamins and all of those nutrients that you need to support heart health and digestion, immunity, and also really help with those energy levels. I love to just eat some fruit whenever I'm feeling a little sluggish because that that natural energy and that natural sugar from the fruit really is a good pick me up.
It's funny you mentioned that because
Sure.
years ago, I think someone told me that like eating an apple can actually help like kind of wake you up just as much as like a cup of coffee. And it's so true. I don't know if y'all have ever done that, but if you're feeling sluggish, like eating an apple, there's something in the apple that like gives you this burst of energy. So
The healthy sugar.
healthy sugar, yeah.
Yeah, an apple a day keeps the
Doctor away.
That's
Hey.
right. There is some truth to that. I was at my hotel this morning and I grabbed a banana. That's another one of my go-tos is just a banana because they're quick and easy. You can take them in the car and they're simple to eat. So that's my go-to, apples and bananas.
Love it.
Then also choosing quality protein. So another way that you can get the nutrients that you need is making sure that you're getting quality protein. Now, this, as I mentioned before, is going to support your muscle, your metabolism. This is going to make you feel fuller longer so that you're not inclined to go for those sugary sweet snacks or those highly processed foods that lack nutrition. Protein is full of has really great calories that are going to sustain you for a lot longer. This also helps with healthy aging as well, as I mentioned, with your muscle mass and things like that to keep you from, to help you recover quicker in the event of an injury. I actually hurt my ankle. I am getting a little bit older, and I was on a trampoline last year and I hurt my ankle. And everyone told me that I was too old to be on this trampoline, but I don't know if y'all have been on a trampoline lately, but I don't think that there's an age limit. Once you get on a trampoline, you're just a kid again. And I failed to believe that my age was a factor, and I did injure myself, unfortunately. And at 39, it was a lot harder to heal. Actually, I've never really had an injury, so I didn't know what it would take. But I'm in very good shape. I would like to think that I can heal appropriately, but in this event, I was down for 6 months, y'all. And that was the situation that really made me realize how important it is to make sure that I am taking care of myself as I age. Because as I mentioned, this was at 39 years and it took me out for 6 months. And the immobility that I had during that time, the weight that I gained during that time, the impact that it had on my mental health, just not being able to do the things that I enjoy doing and my lifestyle being impacted by that. It was a big, big wake up call for me to make sure that I am doing everything that I can, especially as I age, to make sure that I'm taking the best care of myself. So that's why it's important to make sure that you're doing things like this. And again, having that protein, you can get through eggs or Greek yogurt, chicken, fish, and also beans and nuts have a lot of protein in it as well. So just making sure that you are having protein with every meal and getting enough protein is going to be a really great tip for you to get the nutrients that you need. Also, I like to think of myself as a healthy fat, but choosing healthy fats are important as well. And you can think about that as like avocados, those nuts that we talked about with protein. So you can get healthy fats with your nuts, and you can also get protein with nuts. So just be very mindful of portion sizes. So practicing that portion awareness. About a handful of nuts is a portion. So don't get too carried away when you're trying to get all of your nutrients from nuts, because they are yummy and nutty and salty and crunchy, and they're a perfect snack, but they can consume your calorie intake very quickly if you get a little overloaded. And then hydration. That is one thing that another thing. I try to, be my best version every day, but I have realized that I am not drinking enough water throughout the day. And so our bodies are made up mostly of water. So it's so important to hydrate our bodies. This really, again, impacts the way that our bodies metabolize the foods that we eat and the energy that we use. So it really is important to make sure that we're staying hydrated. This is going to help with energy, focus, digestion, those headaches that you may notice that you're starting to get or you're suffering from. And it really can impact your mood as well. So this is really important, a really important tip for prevention, because as I mentioned before, our bodies are heavily made up of water. So we need to make sure that we are putting that back in so that we can continue to make sure our machines are functioning appropriately.
And a good rule of thumb for staying hydrated, for example, if a person weighs 200 pounds, drinking 100, half your body weight in ounces. So if I weigh 200 pounds, I would try to shoot for 100 ounces of water. That's a good rule of thumb for trying to stay hydrated as well.
And that's a lot of water. So if you think about it, that's quite a bit of water. So that means that you need to be drinking it throughout the day. And so keeping a water bottle with you, if you're anything like me, you have a cabinet full of them and you forget them every day. But I do have an Awala bottle that I recently purchased, and it's been really fun. So that's my new trick, is to just keep a water bottle with me all day. And as I mentioned before, limiting those processed foods and practicing portion awareness. Again, I like to say something that one of our other wellness consultants says all of the time. Mark Zolich is known for saying, if you could not eat it 500 years ago, don't buy it. That means that it's made in a factory, it's not whole, it's not true, it's a processed food. So of course we know that convenience and things make processed foods. It's hard to go just on a pure whole diet, but really limiting those processed foods, being very mindful of when you are eating them and how much of them you are eating, and trying to find ways to fit some of these other whole natural foods into your diet regularly is really going to help with that side of the nutrition. We've got another Kahoot.
Those in the bottom 25% of VO2 max or aerobic fitness have higher risk of all-cause mortality than those in the top 25% of fitness by
What percentage?
50, 100, 250, 400.
VO2 max is your aerobic fitness level or score. Oh, all right. The answer was 400.
Yes.
That's high.
Yeah.
So Sharif, what does that mean?
That means if you just improve slightly, you decrease your risk of dying by 400%.
Wow.
And we'll get into this next question that'll highlight what VO2 max is, and then we'll go into further detail. But let's check out the leaderboard. LS still in the lead. We have another quiz. So what is the average VO2 max range for a healthy adult? 10 to 20, 60 to 75, 30 to 45, or 80 to 95? Thirty to 45 is the answer. Who is that?
All right.
All right,
That's
Nessa.
the top.
So as Tasha mentioned, VO2 max is your measurement of oxygen consumption. So if you can think about it like it's your body's fuel gas mileage. So if we have two individuals and they both go up the stairs and one of them is breathing extremely hard and the other one isn't, we can assume the person that's breathing hard has a lower VO2 max than the person that's not, because lower event activities are taxing their bodies more. So, which is why it's the best single indicator for aerobic fitness. But to add to that, it's also being assessed as a biometric marker. So it has a correlation to overall health as well. Because of bullet point number 2, the higher your VO2 max, the more efficiently your body delivers and uses oxygen. And that's important because the body can't move without oxygen. And another important thing, higher VO2 max is also linked to decreased risk of chronic diseases. But this can be improved with consistent aerobic training. And a few tips to improve this is being consistent. That's the most important thing. So you want to aim for 150 minutes of moderate activity per week. And moderate activity can be defined as an increased heart rate, but you're still able to hold a casual conversation if you want to think about what that intensity looks like. Next, you want to increase duration gradually. So we want to start small and increase our workload until it becomes easier. So many individuals, they get started walking, they might start walking for a mile, but they never walked before. So the next few days they might have pain, but that could have been prevented. Instead of just walking that mile, maybe you walk a quarter of a mile for a week, and then you add half a mile the week after that, and slowly build up to that. So you able to decrease risk of injury or anything like that.
Sharif, that reminds me, recently I was at a conference and somebody was telling me that they got a walking pad and they were super excited about their new walking pad, and they had turned their walking pad on as they were watching TV. And before they knew it, they had walked for an hour and a half. And they did this and they were so excited that they were getting their steps in, and they did this for 3 days, like in a row. And all of a sudden they were in the hospital or in the doctor's office with back pain. And they were like, this is all because of my walking pad. And then they just folded the walking pad up and put it away. And I was like, oh no, that's what we do so often, is we get excited about a new thing, or, we decide that we need to make a change and we go so hardcore that then we end up with an injury and then we stop. And so it's so true for you to say to stop and just maybe start with a quarter of a mile, or instead of doing an hour and a half, start with 20 minutes. So it's great to be excited about these changes that we want to make, but it really is important that we are mindful of where we're starting and we start at a level that is
Ease our way
appropriate
into
for
it.
us. Yeah.
And that's important. We'll have a slide after this that'll give you a way to test where you are, so for your starting point as well. But for our next tip, we want to use progressive overloading. So that's increasing speed, incline, resistance, or you can decrease rest time in between. Let's say you're doing an interval, you're walking at 3.5 miles per hour for 3 minutes, and then you walk at 2 minutes at 2 miles per hour. Instead of 2 minutes, we want to decrease that time to 1 minute. That would be decreasing rest time, and that also improves intensity, which leads to our next tip: include high intensity work. So exercising between 65 and 80% of your max heart rate. So when you work out at a higher intensity, it has an inverse relationship with time. So at a higher intensity, you can work out in shorter periods of time. And a higher intensity, like it's laid out here, is 65 to 85% of your max heart rate. And you can figure out your max heart rate by doing a simple equation. 220 minus your age will give you a predicted value for your max heart rate. Next thing you want to do is avoid smoking and physical inactivity. And I want to point out that physical inactivity. So try to diminish how much time we're sitting down, watching TV, and eating our snacks, because those go in conjunction with each other. I don't know about y'all, but when I sit down, I snack. So that also helps with the nutrition. And then next, strength training helps as well. So being able to increase the size of that left ventricle, since that's the biggest muscle in the heart, that helps to push out blood into the rest of the working tissues. So let's say if you want to figure out where you are in your VO2 max, since it's related to overall health, there's 3 different types of tests you can do: the 1 mile walking test, a mile and a half run test, and the 12-minute run test. For the mile, I arranged this in the order from least taxing to most taxing. So whichever one you think you would align with best, you can use that. And you can screenshot this slide and try to take it on in your free time or anything like that. But it gives you directions on how to. And if you want to look up the 1 mile walk test, You'll have to input some values. It's called the Rockport equation, and that'll help you get your VO2 max. It'll be sub-maximal instead of maximal, but it'll give you a good idea.
Yeah, and I think a lot of the newer activity or tracking devices, like my Apple Watch, actually measures my VO2. So it could depend on which gadget you have for measuring your activity. I know, like the latest Aura Ring, the 4, also measures VO2 max. So you might have a device that's already measuring it for you, but this is a great tool to use to kind of get that aerobic number that you would need to know.
And building on that point, so VO2 max is becoming a hot topic now. So you'll see it more and more if you haven't seen it yet, because it's increasingly becoming a biometric marker. So you might want to get a handle on it. So when we say knowing your numbers in the future, this will be a number that you want to know as well. So this will give you the breakdown of where your VO2 max is linked to based on age with either test that you do. So if you do the 1 mile walk, the 1.5 mile run, or the 12-minute run, this will give you if you're poor or fair. So you want to be above the fair portion based on your age. And you can screenshot that as well when you do your sub-maximal testing on yourself. But this is an important one for individuals who don't work out. For example, when Tasha gave the example of the person who walked on the walking pad, this is something that you can do. When I was working with cancer patients, this is the first fitness exam we would give them. It's a simple 6-minute walking test. You try to walk as far as you can for 6 minutes, and you can rest in between. You can walk as fast as you want. But the idea is you want it to get easier over time. So you want to pay attention to your breathing patterns, how you feel afterwards. All of that is important. And this is a simple test that you can do. It won't give you a VO2 marker, but it's something that you can do that's least taxing, even in the 3 that I gave you in the previous slides. Next, according to studies referenced in the book Outlive, low muscle mass and strength increase the risk of death by 40%, 75%, 100%, or 300%. What do y'all think it is?
Probably the biggest one.
300%.
300%. Wow.
Who's in the lead?
Nessa.
Oh, come on, Nessa. So, muscular fitness is important, as you just read in the last quiz. It affects our bone mass, so being able to load those bones will help prevent osteoporosis. Especially for women, it's important to make sure you're loading the bones. Muscle mass is also related to sarcopenia. So being able to lift weights and decrease sarcopenia from happening. Also, the most important thing is reducing that risk of injury. So like how Tasha mentioned, that person that was walking on that treadmill, if they were also strength training, it would have reduced the pain on that back as well, because they all play a part with each other. And our strength training also helps us do daily activities as well. And then fat-free mass and resting metabolic rate is related to our weight management. So those are things we want to pay attention to. So 6 tips for improving muscular fitness. 1, being proper technique. That's most important, because if you're injured, you won't be able to do anything. So it prevents injury, enhances our movement efficiency, and it's quality over quantity all the time. Consistency would be number 2. We want to aim for 2 to 3 resistance sessions per week. We want to prioritize our functional movements. So that's daily activities. So balance, mobility, exercises like squats, overhead presses, they all play a part. Strength and endurance training. So muscular fitness is more than just how much weight you lift, which is strength. It's endurance. How long can you lift that weight? And power. Can you move that weight over a short period of time? And recovery. Like Tasha talked about, many things go into recovery. So food, sleep, active recovery, they all play a part when we're doing our muscular fitness training. And then last, our proper nutrients, getting adequate protein, carb, fat, and hydration intake.
That's what we talked about.
So, look at that, it's all connected.
It is all connected. We don't just say it. This is what the studies and the research and the science says to do. It's not just us saying, do these things.
So these are a few tests that you can do to get a baseline measurement of your muscular fitness. One being grip strength. If you can buy this device, a hand dynamometer, and it'll give you, you squeeze it, and it'll shoot you out a grip strength number. And this is important because grip strength is related to longevity. So this is something we want to pay attention to.
It's also, I'm learning related to your dementia risk. And
Mhm.
so they're finding that, folks that have, as they age, a decreased grip strength are more at risk for dementia. So that's another, incentive for keeping, this strong.
Really good. Yeah.
Keep your brain intact. Next one you can pay attention to is the push-up test. So you don't need to buy any devices to do a push-up test, but in the next slide, I have results based on age that you can pay attention to. But this is another one that can give you a good idea of how strong you are and where you want to get to if you're not in the necessary levels that you want to be.
And then everyone's favorite, the pull-up test.
That was not really a test for your overall function related to longevity. That's more of just to get you an idea of what you can and can't do.
And embarrass you in gym class.
Well, I'll tell you right now, I can't do pull up. So
She needs to work on her back muscles.
hopefully that doesn't mean that I'm gonna die young because I've tried my whole life and I don't have the ability to do that.
Well, if you can hang there for a long time, that might be more correlated to grip strength.
I can hang, I just can't pull up.
So just hang.
We thought about bringing a pull-up bar in here and seeing if we could get a competition for y'all, but we couldn't find one.
So this is a graph of push-up standards that come from ACSM guidelines. So it's based on men and women and then age range as well. So this will give you a good idea where you should be. So for the pool, most of our individuals are between 40 and 49 years old. So I believe we have mostly women in the chat. So if you want to be good, you should be able to do 11 to 14 push-ups. No knees on the ground.
Yikes. Easy for you to say.
Yeah. And this is another test for individuals that might be older or might be dealing with other ailments that won't allow them to do like a one RM squat test or something like that. So this is a sit to stand test. So you just sit at the edge of the seat, hold your arms, and you try to see how many times you can get up and out of the chair in 30 seconds. And this is related to fall risk as well. And I know Tasha mentioned she was down for 6 months with her ankle injury. I believe she took part in this test as well when she was going through physical therapy. So it's just a good starting point for individuals who've never worked out before or might be dealing with physical ailments that hinder them from doing more taxing things.
All right, let's turn the camera on. Sit to stand test right now. Everybody, who can do the most?
Really?
No.
I was ready. I was ready to jump up.
So if you want to build an exercise plan, here's some tips that you want to pay attention to. First, you want to create a goal. So then this is how we break down that goal. Frequency being number one. So how many days per week? Breaking up your day, thinking about your day. Let's say you don't have time in the afternoon. Maybe you think about chunking your activities throughout the day, but that's just something you want to pay attention to. Intensity. Do you want to work out at a moderate level or a vigorous level? Moderate being more laid back, but increasing heart rate still. Vigorous being more taxing to the body. Time, so duration of the activity, and that'll go in hand with the intensity. Like I mentioned earlier, they have an inverse relationship. So we're working at a moderate intensity, we're going to work out a little longer. If we're working at a vigorous intensity, we're going to work out in a shorter time period.
We're learning so much more about this and how, those small bursts of activity really do add up for overall benefit. So, even if you don't have like an hour to work out or exercise all at once, I mean, even just taking like 2 to 3 minutes at a time, doing some flights of stairs or just doing something, active at a higher intensity, or, taking a 10-minute brisk walk. And like, if you can take a few of those, like that's going to add up, and you're going to see benefits. So it's just something to keep in mind, because I know we don't always have an hour chunk in our day.
Can you pause real quick? Let's exit this and then try to get back into it. It's stuck on a slide. So we want to make sure that,
How we do that?
let's stop sharing and then reshare and see if that helps.
Then go to share over here on the right.
Sorry about that, y'all. They said it was stuck on
Just click on that one.
And
Which one?
so, yeah,
The one I'm on?
if y'all attended boot camp, Sean Foy talked about 60-second bursts. And since our boot camp conference, I've actually taken that away on the road. There's so often, like just for me to come into the office here in Austin, it's about a 4-hour drive for me from my house. And so I try to stop once an hour and just do like 60 seconds of squats or, push-ups against the side of my car. And I might look so silly out there doing it, but it helps wake me back up. It gives me like just 60 seconds of moving my body and doing something rather than sitting in my car for 4 hours straight. So even incorporating small little bursts is going to be a great way. Okay, it looks good.
Okay. Next would be that mode of exercise. So most activities fall under aerobic or resistance. So, but that could be anything. Let's say you like to dance, that can be your mode of exercise. Let's say you like to run, that can be your mode of exercise. You like to lift weights, that can be your mode of exercise. It changes from person to person, but highlighting what type of exercise you want to do is important. And then volume. So that's the total amount of exercise. So let's say we're resistance training, our volume will be our weights times our reps times our sets. That's our total volume. And then progression is our gradual increase over time. So how do we make what is now consistent or easy for us? How do we make it harder so we can reach that level? And then we make it harder again and reach that level. That's what progression is. And that's what we want to do with our workouts. And another thing I want to point out is movement is just as important as working out for this hour a day. Like they all highlighted, movement throughout the day is way better than just sitting down all day and then going to work out for 1 hour. So making sure we're getting our proper steps, 7 to 10,000 steps a day in conjunction with our exercise plans will give us the best chance to fight off these chronic conditions.
Yeah, I'm glad you mentioned that because, they say like if you can just get up every 45 minutes and do something, even if it's like 10 squats at your desk, like sitting back into your chair, is going to really improve your metabolic health. So, that's kind of the goal really is like every 45 minutes to an hour, try to get the move. Awesome. Okay. Thanks, Sharif. So, next we're going to jump into some lifestyle factors that can really affect your body's ability to fight off disease and prevent chronic illness. There are several lifestyle factors, and because of time, we're just going to talk about a couple. The first one being sleep and how sleep is so crucial for helping prevent disease. Okay, so people sleeping less than how many hours per night are more likely to get sick and respond less effectively to vaccines. Okay, so people sleeping less than 6, 7, 8, or 9 hours are more likely to get sick and respond less to vaccines. What do y'all think it is? All right, so the answer is actually 7. So if you are sleeping less than 7 hours, your body really is going to be, not at its best ability, fighting at its best ability. So sleep does so much, but one of the things that we kind of take for granted that it does is it really affects your immune function. So it supports balanced immune cell production. So if you're not getting adequate sleep, your body is not going to be producing those killer cells that are going to fight off disease and illness, viruses. So that's why you might find like when you're feeling run down because of lack of sleep, you're more likely to get sick. And that is why, because your body your immune system is not up to par. It's just not able to be at its full functioning ability. In addition, it does improve vaccine response and resistance to illness. And so another thing that lack of sleep can do is it can really increase your inflammation in your body. And that's going to put you at more risk for chronic disease. And it's actually going to make vaccines less effective, which during flu season, especially, we want those vaccines to be as effective as possible. So, but yeah, so that's why sleeping is so crucial. And it really is, no less than 7 is what studies have shown. You need at least 7 to be giving your body the best, the best bet really for fighting off those diseases. All right. So another thing that studies show and that we know is how crucial sleep is for protecting heart health. It does so many things. One of the things is it helps regulate blood pressure and inflammation. And so sleep promotes something called nocturnal dipping of blood pressure and reduced heart rate. And this relieves the stress on blood vessels. So, while poor sleep increases inflammation, hypertension, and metabolic function, these are all key things that can attribute to heart disease and stroke. So if you're not getting that adequate sleep, you're not letting your body get into that nocturnal dipping, which again relieves some of that pressure, and it's going to decrease your risk for the cardiovascular disease. This is something that I found really interesting, doing the research for this presentation. We hear more and more about, increased prevalence of dementia and Alzheimer's. And so this really stuck out to me as being just, to me, probably one of the most important reasons to get adequate sleep is because when you sleep, you're activating your lymphatic system, and this can clear out some of these toxins, the amyloid betas that are related to these cognitive decline diseases. So if we're not getting adequate sleep, we do know that the body eliminates these toxins at twice the rate as we're sleeping than we're awake. So it's essentially your body and your brain's time to clear out all these toxins, again, that are directly related to cognitive decline risk. So I don't know about y'all, but like for me, that's, my mom was recently diagnosed with Alzheimer's. And so it's top of mind for me. And I feel like, gosh, if that's one thing we can do to help eliminate our risk for that, then it's getting sleep. So yeah, so important. So, how do we get better sleep? I mean, that's kind of the age-old question. And I think it's really going to vary for everyone, but prioritizing sleep, I think, is so important. It's like you almost, just like with anything else we have, you have to kind of put it on your calendar, if you will, not maybe officially, but you have to, know that, okay, it's 9 o'clock. It's time for me to wind down. Like, I'm not going to push next episode on my Netflix binge, or I'm not going to start scrolling Facebook. Like, that's your time to, start getting ready for bed. And maybe that's not your time, but whatever time that is for you, to just like prioritize your sleep, getting ready for sleep, and practicing good sleep hygiene. So, maybe not having your phone near you, making sure that you don't have lights on in your room that are gonna keep you up. I know that I was talking to Tasha earlier, and she was sharing with me that she recently started wearing an eye mask, and that's really helped her. I know that I found, like, if I do need to take a nap during the day, putting an eye mask is it's super helpful. And so, especially when you travel, because you never know, like, the curtain situation or what kind of like light is going to be in a room. So I think just that's like a kind of a underestimated way to like really increase.
I never knew how much of a difference it would make until I bought one. And I use it. I have three. I have one at my house, one in my travel bag, one at my boyfriend's house, and now he has one and my son has one. So everyone's wearing a sleep mask, and we're all sleeping better at night because of it.
I love it. Yeah. And the one thing that's not on here, but or I didn't mention yet, is earplugs. And so, nowadays maybe you don't like earplugs the way they feel. You can buy, if you Google motorcycle earplugs, they actually lay flat. So things that are not going to be uncomfortable when you're using them. And you can even buy these like fancy things that kind of go over your ears, and there's like white noise and everything. So whatever it is that works for you, I say try it, because yeah, sleep is so important. Limiting stimulants, I think we all kind of know that. It's like tempting sometimes when you're feeling sluggish to go get a coffee at like 3 o'clock, but that really can, depending on how you metabolize caffeine, it really can affect your ability to sleep. And then of course, managing stress. I know for me personally, if I have like a really long to-do list running through my head at night, like I'm going to wake up at 3 o'clock in the morning and think about all the things I need to get done. So I think it's important maybe to, what can you do before you go to bed to eliminate that anxiety and stress? And sometimes it's just like jotting down the things that you have to get done so that you don't take those to bed with you and you're not like just ruminating on those.
That's a good idea.
All right, and stress management. So let's do another quiz. Chronic stress impacts which of the following? Heart health, blood pressure, immune system, or all of the above? All right,
Good
you guys
job.
nailed it. Yes, unfortunately.
Nessa's
Good
still
job,
in the
Nessa.
lead.
Unfortunately, yeah, stress really impacts all of these things. So that another reason to really try to keep our stress in check. It can increase our cortisol levels, which can lead to all kinds of things, high blood pressure, high cholesterol, and increased risk of heart disease and stroke over time. It can actually also destabilize blood sugar levels. So it can, counteract insulin, resulting in elevated blood glucose, putting you at higher risk for type 2 diabetes. So, and then we kind of touched on this already, but autoimmune diseases. So we do know that stress can weaken the immune system. We talked earlier about how when you're feeling stressed and run down, you are more likely to get sick. And that's simply because that stress hormone and those truly are, weakening your immune system and, hampering your body's ability to fight off disease. Okay, so stress relief strategies. So I know these are a lot easier said than done, but it is really, as we know, so important to find a way to eliminate your stress, and that's going to look different for everyone. So for some people, it could just be a little brisk walk. Maybe you just need to go, take the stairs, like clear your mind, get your blood flowing. Prioritizing sleep. So I know when I'm have a lot going on, I've got lots of, things I need to do. I have to be there for and present. Like I have to prioritize my sleep because for me personally, I don't know about y'all, but like if I'm feeling tired, I just can't handle life. Like I need to be like fully rested to be able to manage, the day to day, the tasks, that we have. So for me, that's kind of my biggest thing. Focus breathing. So, this can look like box breathing, maybe, inhaling for 4 to 6 seconds and then holding it for 4 to 6 seconds, breathing out 4 to 6 seconds, and kind of just doing that in a rhythm to help, balance your system. Staying connected, having community, having someone, whether it's at work or at home, a neighbor or a relative, someone that you can connect with, someone you can vent to, someone you can bounce ideas off of, someone that you can feel that you can always like reach out to, and just having that, building that connection and community is really important. Tasha already talked about healthy nutrition and how, those foods that are going to help decrease your inflammation in your body is going to help you also, um, you know, eliminate some added stressors. If you're constantly eating processed foods, probably going to increase your inflammation, therefore just exacerbating that stress cycle.
It is a cycle.
It is. Last but not least, setting boundaries. And this is something I think a lot of us struggle with, but just the ability to sometimes say, no, thanks so much for that opportunity, but I'm not able to commit right now. Setting boundaries and being realistic with expectations on what you're able to put in. I know it's hard, we kind of associate saying yes to like being worthy, or like, we want people to still like us and all those things. But I think it's better if we can, just be honest with ourselves about, what we're able to give. And that might vary, depending on the time of year. Sometimes you're able to give more, sometimes you're not. And so we just have to be better about setting those boundaries and being more honest with ourselves about what we can contribute and when.
It is a hard one, but it is so crucial to set boundaries, especially when you have a family and all of the things. Like it's important to be able to say no sometimes. We're going to get into preventative screenings really quickly, because this is another way to practice prevention in our health care and in our lives. So just really quickly going over a few different types of preventative screenings. Feel free to screenshot some of these charts that you may see, but let us know, when was the last preventative checkup you got? Good job, you guys. Y'all are on top of it within the past year. That's great. That's how often you should be getting your preventative screenings. But just so you know, it's important to take some of your numbers regularly, or know your numbers regularly, like your blood pressure and your cholesterol and blood glucose, especially if you are high risk. Of course, we get those done every year when we go in for our annual exams. But if you are high risk, making sure that you are getting those done maybe a little bit more often, and then just keeping up with that. And of course, your dental exams every 6 months. We had our annual review with Blue Cross Dental team yesterday, and just the way we had discussions around chronic conditions and other factors associated with dental health. There are so many things that can be caught in a dental exam. So it's not just about having really pretty pearly whites. There really is a lot of risks that can be detected in a dental exam. So you can get that one every 6 months. So that's a really good one to keep on top of as well. Another quiz. When would someone may be eligible for a lung cancer screening? Is it 50 to 80 years old, a current smoker or used to smoke, or have a history of 20 or more cigarettes a day for a year, or all of the above?
Good job. Yeah. All of the above on that one.
Yeah, so it's really important to make sure that you're getting your cancer screenings as well. Catching things at an early stage is way better than catching them when they're further along. It's a big one people always say is like, I'm scared of what I'm going to find out, so they don't go. Well, that's not a really good reason to not go get a screening, because when you don't go and then you start having health issues and you decide to go, you might indicate something or catch something at a further stage. And therefore, that's going to be a lot harder for you to reverse the effects of. So making sure that you're getting all of those cancer screenings done at an appropriate time, especially if you are, if you have higher risk factors. Maybe there are some genetic history with, or family history with some specific cancers. You might want to have those conversations with your provider and your physician to make sure that they are aware of your medical history or your family history, so that you can get those screenings early. And staying on top of those, because we want to make sure that we're catching it early. And then also just making sure that you are staying on top of those vaccines. This is a really good way to prevent a lot of illnesses. So there is a little chart for the appropriate time for some vaccines by age. You can feel free to screenshot that as well. And knowing your numbers. And just for the record, for anyone in our fully pooled groups, these preventative exams and screenings are covered at 100% on most all of those plans. So we want to make sure that you are getting those. Knowing your numbers, I am guilty of doing those health assessments on like Blue Cross Blue Shield or WebMD1, and it asks for your blood pressure, and I'm like, I don't know, but it's normal, because I need to be better about knowing my numbers. But know what a healthy recommended number is, and making sure that your numbers are within range. And again, getting at least 150 minutes of physical activity, 2 days a week of strength training, and of course, at least 7 hours of sleep at night. And managing that stress daily is all really good things to do. We did also recently have our annual review with Blue Cross Blue Shield in all of our pooled groups. And just so you all know, as a relevant conversation, especially with renewal season approaching, all of our preventative care screenings are actually down across the pool, with most screening rates declining except for mammograms. So chronic condition prevalence is also high, especially compared to Blue Cross's book of business across our pooled groups. So we do have a population risk for chronic conditions and also cancer prevalence. So it really is important that we are making sure that we are getting our annual exams and managing those chronic conditions, so that we can make sure that we are taking good care of ourselves and living, again, like I said earlier, our healthiest lives. All right, well, we are going to share with y'all a couple of our employee benefit specialists. They have an employee benefit specialist minute. They're going to highlight a topic very quickly for you. So let's stop sharing the screen and go to camera. And we would like to introduce, we have Eric
And Cassie.
and Cassie. We're going to make a quick swap over here.
Hi, like Tasha was saying, my name is Eric. I am an employee benefit specialist for the South Territory.
And I'm Cassie Villarreal. I'm a EBS for the West Territory.
We're here to talk about renewal season. Just wanted to kind of give a brief kind of summary of what's going on over the next few months. There will be a renewal email going out to everybody who handles renewals. It will have a packet of the contract and what needs to be filled out, what needs to be updated, if anything's changing, things like that. You will have a month to fill it out and return it to us. It's really important that you do get it in on time. We understand these things can be complicated. We want to make sure that you are aware of everything that is going on, everything that you are signing. So please feel free to reach out to us, either your specialist or your consultant, if you have any questions about what's being signed. It gives you enough time to set up a commissioners court meeting, board meetings, anything that needs to be done to discuss these changes.
And I'm going to be going over the October anniversary dates. So just to let you guys know, as Eric mentioned, it is important to get these in on time. So for our October groups, the renewal emails will be sent May 22nd, and they will be due by June 26th. For our November anniversary groups, they will be sent June 29th, and they are due August 12th. Our December groups, the emails will be out July 24th, and they are due September 9th. And January groups, they will be sent August 28th, and they are due October 7th. So as Eric mentioned, it is important to get them in on time. And if you have any questions or if you don't know what to fill out, please feel free to reach out to your EBS or EBCs, and we'd be happy to guide you through it.
Thank you so much.
Thank you, guys.
Thank you.
Awesome. Thank you, Cassie and Eric. We are going to go ahead and close for questions at this time. So if y'all have any questions, please feel free to put those in the chat. We will be sending out the deck through email, so we'll share that with you all. I really do want to thank you all for your time and hope that you appreciated this information. I don't see any questions, and I think we handled it right on time. So thank you all so much. Oh, wait, we do have to share the screen back. We have
Our
to see who
winners.
won the leaderboard. We almost forgot. We're going to skip through some slides real quick. Skip.
Just
Yep.
a reminder, you can always find resources on our website or the WebMD1 site.
All right.
Here we
Let's
go.
see. Bailey County and number 3, and then Nessa.
LS number 2.
There she is.
Nessa.
All right.
All right.
All right.
Congratulations, y'all.
We will
Thanks so much.
share, we'll reach out to you all in the top 3 and be sending you all prizes for that participation. Thank you so much.
Thanks, everyone.